The short answer is that all IUDs are very effective. They're the most effective reversible method of birth control. Hello, welcome back to Gyno Info. Or if this is your first time, just welcome. I'm so glad you discovered us. In this podcast, we discuss common gynecological problems in a frank and open way that a normal, everyday woman can understand without a medical dictionary. Today, we'll be talking about IUDs and specifically about copper IUDs. One of our listeners wrote that she was sick of having to remember to take a birth control pill every day. She writes that she's thinking of switching to a copper IUD like many of her girlfriends were doing. And she wants to know what I think about the idea. First of all, I think it could be a great idea. But like everything having to do with her body, she needs to first inform herself thoroughly and decide what questions she will want to ask her doctor. This is where Gyno Info comes in. So today you'll be hearing about what a copper IUD is, how IUDs overall work, how effective they are, what their risks and downsides are, and also how quickly you can get pregnant after you take your IUD out. IUD stands for intrauterine device. They also used to be called coils because in the past, some IUDs were coil or even ring-shaped. Now, all modern IUDs are T-shaped. An IUD is a small T-shaped piece of plastic that is put inside a woman's uterus, inside her womb, to prevent pregnancy. It is guided inside the womb through the cervix, the opening of the uterus that sticks down into the vagina. The T-shaped IUD sits with its arms folded inside a thin applicator tube. Once this applicator is slid all the way into the womb, the IUD is pushed out, and as the applicator is pulled back, the T-shaped IUD springs open like an umbrella, and it stays inside. All IUDs have a string attached to them at the bottom end of the T. The end of that string hangs about a quarter inch down into the vagina, sometimes half an inch. By pulling on that string with a clamp, your medical provider can remove the IUD easily in less than 30 seconds when it's time for it to come out. Putting in the IUD takes less than 3 minutes. It can be done in the doctor's office after cleansing your vagina with a disinfectant that doesn't sting. It is actually not as painful as you might think or have heard, especially if an experienced doctor or nurse practitioner does it. You will experience some cramping, but generally less than the cramps on the worst day of your period, and only while the IUD is being inserted. It does make a difference if you have given birth before. If a whole baby has already passed your cervix before, that cervix will not react much when a tiny IUD applicator tube is passed through it. The more times you have given birth, of course, the less you will feel the IUD being put in. Also, placing the IUD is generally done during your period when the cervix is already a bit open to let the blood clots pass through it. And a good tip is to take a double dose of ibuprofen or naproxen plus 2 extra strength acetaminophen, Tylenol, about an hour before your doctor's appointment. Acetaminophen in other countries is called paracetamol. Those 2 pills can safely be combined without problems, but you shouldn't take them on an empty stomach or else you'll be sick. Most importantly, do not take any other drugs than ibuprofen or naproxen, acetaminophen, paracetamol. It might make it dangerous for your doctor to give you any other local anesthetics in addition to the drugs you have already taken. And remember, to always tell any doctor exactly what you have taken at home. Now let's talk about how IUDs work. The main action of all IUDs, old and new, is to occupy the womb. That way, when a fertilized egg arrives in the womb and finds that there's already something in there, in this case the IUD, it will not stay and go on to grow into a pregnancy. That egg will simply be washed out and disappear almost 100% of the time. Let me explain this a little bit further. During the years a woman can get pregnant, she produces one egg every month inside a little cyst inside one of her ovaries, either on the left or on the right. Rarely two eggs, but we're not going to go into that. When that one egg is ready, the cyst pops open. This is called ovulation. The egg then jumps out and is picked up by one of the fallopian tubes that guides it down into the uterus, the womb. If on the way to the uterus, that egg runs into some sperm, and if one of those sperms manages to drill into the egg, a pregnancy will start growing. As soon as this super early pregnancy, that so far is made up only of a few cells, arrives in the uterus, it sticks itself to the muscle wall of the womb and connects to the blood vessels in the wall, the blood vessels of the mom. Then the cells divide up into a placenta part and an embryo part. After that, the pregnancy part just grows and grows, turning into a fetus and then eventually into a baby. The other part, which is connected to the mom's blood vessels, grows into the placenta. The placenta feeds the growing fetus until it is born as hopefully a very healthy baby. Because the placenta is directly connected to the mom, any drugs or poisonous things that the mom eats or injects are directly mainlined to the fetus. This is another important reason to live and eat healthily during pregnancy. But back to IUDs and not getting pregnant. The process of the fertilized egg attaching itself to and beginning to connect with the blood vessels in the wall of the uterus is called implantation. One of the main actions of all IUDs is to prevent implantation, no matter what kind of IUD it is. This is how they prevent pregnancies from ever starting up. In the olden days, when caravans of camels were carrying heavy loads of goods across their backs across the Sahara, the camels' owners prevented the camels from getting pregnant by placing a pebble in their womb. Just having something in the womb, be that an IUD or a pebble, in the case of the camels, will keep a fertilized egg from wanting to settle down in a uterus that's already occupied. It will not implant. Now, modern IUDs have two other ways that make them work even better. The first is to add a little bit of copper to the stem of the T-shaped IUD. The second is, instead of adding copper, to add a sleeve full of hormone called progestin around the stem of the T. Today, we're only talking about copper IUDs. Hormone IUDs and their pros and cons will be a topic of another podcast. The copper in the stem of the copper IUD is released continuously in tiny amounts inside the uterus. That has three extra benefits. It makes the IUD more effective because the copper is hard on the sperms that are trying to pass through the womb to go and meet the egg up in the fallopian tubes. They get damaged by the copper and they will never reach the egg to begin with, and so they cannot fertilize that egg. No pregnancy ever starts. It also makes it that the IUD is more effective because a fertilized egg likes the additional copper even less than just the plastic IUD alone, and is less likely to implant stick to the wall and begin to grow into a pregnancy. It just washes out. And on top of that, copper is also hard on bacteria and kills them off. Because of that, copper IUDs give you a little bit of protection from bacterial infections that might be sitting in your cervix and your vagina. But to really protect yourself from sexually transmitted infections and the damage that they can cause, you should be using condoms 100% of the time and also get checked regularly. Here's one very important point to remember about every single type of IUDs. All IUDs, whether they're old, modern, copper, or hormone IUDs, only protect you from pregnancies inside the uterus. One of the reasons this is true also for copper IUDs is that copper IUDs do not stop ovulation at all. They only prevent implantation once the fertilized egg makes it to the uterus, and they reduce the chance that the egg gets fertilized by making it hard on the sperms. But if an egg gets stuck in the tube on the way there, the IUD can't do anything about it. Any positive home pregnancy test while having an IUD in place needs an immediate doctor's visit, because if the egg did not make it all the way to the uterus, this is a life-threatening condition called ectopic pregnancy. Another topic for another future episode. One of the additional benefits worth mentioning is that copper IUDs are the most effective morning after birth control, also called postcoital contraception or emergency contraception, protection from pregnancies after the fact. When emergency contraception is used in pill form, it is called the morning after pill, a term you might be more familiar with. Copper IUDs protect you from getting pregnant if a condom ripped, or if you were raped, or if you're drunk enough or dumb enough to have sex without using any method of birth control at all. And they are effective up to 7 days after unprotected intercourse. That is several days longer than the morning after pill. This is because a fertilized egg takes several days to arrive in the womb before it implants and becomes a pregnancy. If it finds that the uterus is already occupied by a copper IUD, it will simply not implant. So that was the most important stuff to know about what copper IUDs are and how they work. Now let's talk about how effective IUDs are. The short answer is that all IUDs are very effective. They're the most effective reversible method of birth control. Reversible means that it is not a permanent method like tying your tubes or having your partner have a vasectomy. It's reversible. You can use it and then you reverse it and you can get pregnant again. The effectiveness of all birth control methods is measured with the Pearl Index, the number of women who will get pregnant if 100 women are having regular intercourse and are using a certain method for a whole year. That is the Pearl Index. The higher the Pearl Index number, the less effective is a method. One of the most important factors that determines how effective a method is whether it allows you to screw up and be unreliable. That is why the Pearl Index is often given in two different numbers, one for perfect, super reliable use, and one for so-called typical use, allowing people to take chances. For instance, if 100 women are using natural family planning, generally 25 out of 100, that is 1 in 4, will be pregnant after a year. If they do it absolutely perfectly and never ever take the slightest chance, it may be as few as 2 or 3 per 100 women who will be pregnant after a year. The same goes for condoms, male or females. If 100 couples use condoms after a year, 18, that is almost 1 in 5 of the women will be pregnant. But if the couples use the condoms absolutely 100% of the time they have sex and put the condom on before the underpants come off, it might also be only 2 or 3 out of 100 will get pregnant. For birth control pills, the Pearl Index number is 0.2 to 0.3 per 100 with perfect use. That means only 2 to 3 in 1,000 of women will get pregnant after using the pill perfectly. But as I said, that counts only for women who never ever forget any pills, compared to 20 to 30 in 1,000 women who sometimes forget a pill. Now, the beauty of IUDs is that you cannot screw up. Once the IUD is in, it's in. You cannot forget to use it like with condoms or forget to take it like with the pill. Because of that, the rate of pregnancy with IUDs is the same for perfect and typical use. It's 1 to 2 in 1,000 women per year that will be pregnant using an IUD of any type. Copper IUDs can remain in place and are FDA approved for up to 10 years, but actually are effective for many more years, even beyond the time the copper is used up. Because they last as long as they do, copper IUDs are not only most effective, but they're also, in the long run, the most cost-effective and cheapest reversible method of birth control there is. Now let's look at how quickly you can get pregnant when you remove an IUD. And remember, removing it will take about 30 seconds, but has to be done in a doctor's office. Unlike with birth control pills, where it takes up to a year before ovulation starts up again, with an IUD, a copper IUD, ovulation never even stopped. So you can get pregnant again as soon as the IUD is removed. About 3 out of 10 women will get pregnant in the first month after removing their copper IUD. About 7 or 10 will be pregnant after 6 months, and about 8 to 9 out of 10 women will be pregnant 1 year after removing their copper IUD. That's about the same rate of pregnancy as for women who never had an IUD at all, for the couples who just decided to stop using condoms and go for it and get pregnant. Now, other than wanting to get pregnant, what are other reasons to take an IUD out, even when it has not expired yet? As you've heard, 1 to 2 women out of 1,000 per year get pregnant despite having an IUD. And someone has to be those 1 or 2, unfortunately. Also, as soon as the pregnancy test is positive, it is absolutely essential to make sure the pregnancy is inside the uterus and not in a tube or some other wrong place, which is called an ectopic pregnancy and life-threatening, as I said earlier. A pregnancy that keeps growing in the wrong place is very dangerous and could kill you. It needs urgent treatment. But even if it is not an ectopic pregnancy and the pregnancy is actually in the uterus, the IUD should be removed right away. The earlier, the better. If it is not taken out, it can lead to severe pregnancy complications, such as infections and premature birth. That is why it is important to take a pregnancy test if your period doesn't come with a copper ID, or even if you just have pregnancy symptoms, but that counts also for when you don't have an IUD. Better testing once too much than not testing when you should have. If you have a positive home pregnancy test, call your doctor or clinic immediately. and get it confirmed and see whether you really are pregnant. What are the risks of IUDs other than the possibility that they could have failed and you are pregnant? And let me remind you again, only 1 in 2 per 1,000 women will get pregnant when an IUD is in place after a year of having regular sex. So they're super effective. But nothing is 100% in medicine. Problems with IUDs are best divided into the ones that are undesired, but normal and expected side effects, and things that are real complications. For instance, it is normal and expected that with a copper IUD, period bleeding and period cramps will be much stronger and much longer and much harder. And if you have switched from the pill to the copper IUD, your skin and your PMS symptoms that were much better with the pill will be much worse. These are symptoms that are considered normal and expected unwanted effects of copper IUDs. They have to be weighed against the positive factors such as the price. An IUD may cost a little bit more at the beginning, but is much cheaper than the cheapest pill if you keep it in more than 1 year, let alone 8 or 10 years. The no hassle benefit of not having to remember to regularly buy and then remember to take a pill every single day. And of course, their reliability, the fact that failure rates are so low. Now, if someone has super heavy cramps, a copper IUD might not be the thing because it will definitely make her cramps worse. That is why if our listener that wants to get off the pill has non-event kind of periods, just a little cramping and minimal bleeding, then bleeding a day longer with a copper IUD is no big deal. If, however, she has already very heavy, long, and crazy painful periods, she will not be happy with a copper IUD and should look at other options. I discussed these in my podcast on periods and cramps. It was called My Periods Are a Blood Path. What should I do? You can look it up. If she is on a vegan or vegetarian diet and already has not enough iron in her body to make enough red blood cells, then having an extra day or two of period bleeding might throw her into iron deficient anemia because of lack of iron. And for her, a copper IUD might also not be the ideal thing. All these things that have to be weighed and considered. Now, the real complications with IUDs can also be split into early complications and late ones. The complications that happen at the time the IUD is placed in the uterus and the ones that happen later on. The most serious of the early complication is perforation, pushing the IUD through the wall of the uterus into the belly among the guts or into the bladder, which is also right next to the uterus. And sometimes the IUD is not pushed all the way through the wall of the uterus, just sort of halfway through, but then it makes its way through later and ends up inside the belly or the bladder. You then will need surgery and you have to be under general anesthesia while your doctors look and hunt for your IUD and remove it. All this is very rare and can be avoided again by having someone experienced placing the IUD. Another early complication happens if a woman has a sexually transmitted disease, an infection in her cervix with bacteria when the IUD is placed. Then the IUD will drag those bacteria up into the uterus and make things much worse because they will then travel up into the tubes and cause major problems. If this happens, the IUD will have to be removed immediately and the infection has to be treated with heavy-duty antibiotics. That is why you should always be tested for STDs before putting in an IUD. And the good doctors will do that. One more issue that happens generally right at the beginning or then with the first period after putting it in is called expulsion of an IUD. This happens sometimes because the IUD is not placed quite high enough in the uterus, but it can also happen with a perfectly placed IUD. Some women's uteruses just do not like having an IUD in them, and they push it out with a lot of cramping. It is good medical practice to check with an ultrasound exam right after inserting the IUD to make sure it's placed correctly, and then again after the next period to make sure it's still there and doing its job. If the IUD is not placed correctly or pushed out without the woman noticing it, then she might get pregnant, even while thinking that she's protected, but she's not. One other complication worth mentioning, because it is the cause of a lot of confusion around IUDs, is the following. It used to be that the string used to later remove the IUD was a braided one made up of several strands. That served as a kind of rope ladder for bacteria to climb up from the vagina where the string was hanging down into and then infect the uterus, and then from there the tubes. And this gave IUDs a bad reputation about 50 years ago, half a century ago. When I first trained in the early 1980s, I was still taught that using an IUD was only for women who already had all the kids they wanted, because of such a high chance of making women infertile with those infections. This is, of course, not the case anymore. Modern IUDs no longer have this kind of braided thread. They have a very thin, non-braided string that bacteria cannot climb up on. Infections with IUDs are now very rare, and they most often happen at the time of inserting the IUD when somebody has an STD that was not tested for. And also, as I already mentioned, copper in the IUDs actually fight bacteria. So modern copper IUDs are very safe and are recommended for women of all ages, including young women who haven't had kids yet, by all major gynecological guidelines around the world. So in answer to our listeners, IUDs, copper IUDs, are cheap, effective, and safe, cause more bleeding and more cramps, and do not give you better skin, less PMS, or less ovary and uterus cancer as birth control pills do, but for many women, they are just perfect. This brings us to the end of this episode. I hope you liked it, and it gave you a lot of information that is useful to you and your friends. And you have any further questions about IUDs or any other topics having to do with women's health, please don't hesitate to send them to me at questions@gynoinfo.net. Again, that's questions@gynoinfo.net. And if you like this episode, please give us a lot of likes and share it around and comment and subscribe. All this makes it easier for other women to find it. Especially, it would be super nice if you could subscribe to Gyno Info. It helps Josh and me to keep this podcast going. So thank you. Until next time, thank you for listening. And remember that you and your health are super important and deserve your full attention. Don't ever put off contacting your doctor because you're scared or embarrassed when something feels wrong about your body. Doctors are here to help you, not to judge you. And also, regular well-woman visits are always a good idea that you should make time for. You deserve it, and you owe it to yourself, and you owe it to your body and your health. This podcast is part of Pride House Media, hosted by me, Dr. Burki, produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and a review. It really helps others discover the show. Stay connected and join the conversation by following me on Instagram and Facebook @GynoInfo and on LinkedIn @GynoInfo Podcast. Remember, any questions that I answer or information that I give you on this podcast are to be understood as information only, not treatment of your medical problems. While I'm a very knowledgeable gynecologist, I'm not your gynecologist who has talked to you and examined you personally and is therefore actually able to treat you. So please consult your own healthcare professional with any medical questions or concerns.